leprosy is historically uncommon, but cases have more than doubled in the South in the last decade. Joining me to talk more about it, Dr. Chris Purnell, Regent at Large for the American College of Preventive Medicine. Easy for me to say. What's the message here? Very concerning.
Yeah, I think it's important for the public to understand, Marnie, how leprosy is diagnosed and how you may be potentially exposed to it and whether or not it's curable. There has been a lot of stigma surrounding leprosy, meaning that it was thought to be very contagious. We now know that if a person is diagnosed early and as soon as they get into treatment, they are no longer contagious. You must remain in treatment for 2 years so that you can be cured of it. The second question is, why are we seeing a rise in leprosy cases in Florida? Has something shifted in the environment? We know that you can be exposed to the mycobacterium that causes leprosy by exposure to armadillos, but that's really rare. So is there something else that's happening given that there has been recent population shifts in the area?
And 2 years is the treatment. What does it entail?
So we call it multi-drug resistant treatment. And what it means is that you'll be on several antibiotics, including dapsone, among others, so that the bug, the bacterium in this case, does not grow resistant to the one drug because you have to be on the therapy for 1 to 2 years. So once a person is diagnosed, that's why as soon as you have any symptoms that are concerning, it is important to report to a physician, and this must be reported to a local health department so that it can be appropriately diagnosed and treatment can begin.
What does it mean when the CDC deems something endemic?
So when it's endemic, it means that it's occurring or rising locally. Previously, cases of leprosy were thought to occur in persons who had migrated or traveled to the United States from other endemic regions in the world. But what we're seeing across these last several years in Florida, Central Florida to be exact, is that people who have no known travel, have no known exposure to anyone with leprosy, and no known exposure to people who once lived in regions outside of the nation that are endemic are being diagnosed. So that leads us to think that there is something happening environmentally in those areas that is now growing within that population.
Gosh, pretty scary to have so many unknowns. How do people protect themselves against leprosy?
So the best way to protect yourself is to know what to look out for, right? Because right now we don't know what the exact cause is. There is a minor risk that exposure to armadillos can contribute to a person being infected. So if you are exposed and then you develop a rash, you should see a physician. That rash can be discolored skin patches. You can have hyper or hypopigmented areas of skin. You see swelling of nerves underneath the skin. So you get these lumps and your bumps in your skin. You can even get non-healing ulcers. The skin that is inflamed or infected can become lack of sensitivity, I should say, to pain or to touch. So you can have repetitive injuries that cause harm. And if leprosy goes untreated, that's when we begin to see paralysis, in particular in the hands and the feet. And you can even get blindness.
Wow, scary stuff. Hey, after years of struggling, there finally could be some hope on the horizon for folks suffering from long COVID. Tell us a little bit about this research and what may happen for people who have been dealing with this for the last couple of years.
Yeah, throughout the pandemic, and especially toward the latter stages, we've been saying that COVID has been a mass disabling event. What that means is that anywhere from 10 to 30% of people who have been infected with coronavirus displayed lingering symptoms. And it was a constellation of symptoms, whether fatigue, whether cardiovascular in nature, whether sleep disturbances. And now we're starting to see studies, observational studies that are able to track and monitor persons who are displaying these symptoms. And research is being dedicated to understand what's the cause, because we really don't know. So what the NIH has done in this recovery project is to focus on multiple arms or multiple pathways of causation, whether those are things around electrical stimulation of brain circuits to help fight back against that brain fog that people are experiencing, or even having people stay on Paxlovid for as many as 25 days. The current standard is to treat someone for 5 days because the thought is coronavirus may linger in the body, contributing to long COVID. So we're beginning to have a better sense of what might be driving this mass disabling event that we're experiencing.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television.